I cover politics. That's the majority of my role here. And I have to say, it's so frustrating covering politics and seeing a problem that affects people on both sides of the aisle, real everyday Americans. The government was shut down for the longest in the history of shutdowns in this country, over 40 days. There was no movement on any type of solution related to healthcare costs in this country. I'm curious now what, because it doesn't seem like there's, like we said at the beginning of the conversation, we're really at an impasse here. Neither of these solutions passed the Senate. So does that mean just that the enhanced ACA subsidies essentially will expire, they'll lapse, premiums will skyrocket, and essentially that's too bad for over 20 million Americans?
What's too bad for all Americans, right? Because we're all paying the price. Just because, an insurer's covering it or an employer's covering it, the employer's covering, but that goes into our prices, which goes into inflation, which we all pay for. So we're all paying $16,000 a year for healthcare, right? That's our national average, or excuse me, 15,500. It'll be 16,000 in 26. That's what we're all paying. If we don't bring this down, nothing is going to work. Everything's going to break. And so like I look at the difference between what we pay and the next most expensive country. So 15,000, let's use simple math. $15,000 per person in the United States. $5,000 per person in the developed nations, right? $10,000 per person in Switzerland and Norway, the next two most expensive countries, which have much better outcomes, right? We also have about the worst outcomes. If we could just say, as a country, we're bringing down the cost of care $5,000 a person. Americans, you need to get healthier. Hospitals, you need to get people out of the hospital. Doctors, you need to stop doing defensive care and make sure that everything we do is in the best interest of the patient and the country. Then we can start to move the needle. We set a goal out, say, look, let's take care of people in the meantime, right? We can take care of people. If we reduce the cost of care $5,000 per person, that'd be $1.5 trillion a year, right? That's our deficit. We don't have a deficit anymore. We can afford to give people the care they need. So in the meantime, we have to take care of the people that are losing insurance and take care of the safety net. We have to take care of people to get us there, but we have to have a plan that gets us there. And I would say that if we lay out a plan for 5 years that says we're going to cut the cost of care, the true cost of care, by $5,000 in 5 years, and if we don't get there, we're going to have to take these types of actions, right? If the government can't control costs the way we're operating today. So this is my 5th year as a commissioner on the Medicare Payment Advisory Commission. We advise Congress on Medicare payment policy. And I would say that there is nobody in the United States that actually understands all the loopholes we have created one at a time, that people that, we put our finger in the dike over here and all the money runs out that loophole. And so we have got to have a comprehensive program that has all stakeholders involved, from patients, hospitals, doctors, insurers, and the government, and says, as a nation, we're bringing the costs down so that everyone can have insurance and no one has to go bankrupt because of the cost of healthcare.